So this video is shot, I did parts of this video in another virtual consultation many years ago, maybe 2 or 3 years ago. But I've been asked in one of the comments to go into a little bit more detail about my philosophy of why I think FUE is inappropriate for women. Now, if you've had an FUE as a female and you have a great result, wonderful. I'm not here to poo-poo it, but I want you to understand my philosophy, why I really do not perform FUE in women. I don't remember ever doing it. So first, I want you to understand the traditional way of doing FUE is shaving the back of the head and then harvesting hairs one at a time and then placing it to the front or top of the scalp. So basically, FUE doesn't make sense for women because one is, what woman wants to shave the back of their head? I think it's ridiculous. You don't need to shave it. Whereas if I do a strip, I'm doing a linear incision, and then if I shave 1 centimeter, I take out the centimeter and close it. There's no gap anymore, so that there's no density loss on the back of the head. So no woman wants to, so the two big reasons is they don't want to shave the back of their head, and so there's no shaving when it comes to a strip procedure. And also, in addition to that, there's no density loss in the back of the head, because when you do FUE, you have to take, let's say, 20%, 30%, maybe up to 40% of the back of the scalp. And if you have a 30 to 40% reduction in density, I don't think any woman is happy about that. You are also taking hairs in a zone that is not as good, because usually the sweet spot is toward the center of the scalp. And that's not great to harvest out of these zones that are just not really great for women. So these are the 3 big reasons why I think FUE just fails for women. There's no reason, because my scars in women heal, or anyone heals great. I think their hairstylists couldn't even find it. So let's say even in the worst case scenario, we have a full centimeter gap back there, which I don't expect. Usually mine are so hard to find, they're maybe a millimeter. The woman still can't see it because it's hidden back here. Now, a centimeter would be a real fail to me. I think that would be, if every female is getting a centimeter gap back there, then we're having a problem. And I think that's something that I would say is not acceptable. But I'm just saying, even if you had a centimeter in the worst case scenario, it's something that's pretty well hidden in the long hair. But as I said, most of mine are very, very hard to see. Now, what you're going to hear is, as an alternative to an FUE, to the shaved head, you're going to hear these variations, especially if someone's performing only FUE. They're going to say, well, I don't shave the head. Okay, so 1, you can do what's called a window. So what a window is they shave a patch on the back of the head and then comb that over. You say, well, okay, that's fine. Well, first of all, is that fine to have a hole in the back of your head that's going to take you up to 1 year to 2 to grow back in? I don't think that's fine. I think it's a problem. The second problem with the window technique is you are very limited what you can harvest, because remember what I told you, you can take 30% over a big zone without causing a significant degradation in the back, although as I already told you, you're going to have a density loss. If you take a window, which already sucks because you're having this gap, now you can have to harvest maybe only 20%, or you can harvest 30% on this little area, but now that's not going to even match the sides. And if you try to start pushing it to 50-60% because you don't have enough grafts, because you're harvesting over a very small window, you're going to definitely have a reduction in density in that area, and that's a real problem. So windows, even for a guy, if a male says, look, I'm opposed to a strip procedure, I just want FUE, harvest a window, not going to happen. Even when I have a guy that just wants a scar, I actually go the opposite direction. When I have a small scar, I usually try to harvest as wide as I can, because FUE causes little white dots, and if they want to shave their hair down, I don't want even to harvest in a small area. So even if I have a small number I have to harvest, I do the opposite. I harvest a wider area. It's much more labor intensive for me to do that. But that's for a guy, but just understand my philosophy. The other problem is if you say, well, I don't do a window. These are the things you're going to hear from FUE-only surgeons trying to sell you as a female patient alternatives to the traditional full shave of the backside. So one is the window, which now hopefully is very clear to you why I think the window is a big mistake. As I told you, the 2 reasons is you have this big gap that's going to take 1 year to 2 to grow back. And the second thing, you're going to over-harvest a small zone. It's going to even be more density gradient problems. The other way they're going to say is they're going to talk about micro strips. The micro strip technique is they cut little hair gaps okay, and then they harvest little areas. Well, here's the other problem. Now you have even more of a magnified problem, because unlike a window, now you're taking little rows of strips. That can lead to visible problems in this area, which I think are not favorable. And with microstrips, you have to take a lot of microstrips to have enough grafts to make a reasonable result in the front. And that's very labor intensive. In addition to labor intensiveness, you're not getting enough grafts. And you're going to leave behind little rows of gaps. If you do wear your hair shorter or wear it up, there's a potential you can have linear scars that are not good. The final FUE option you're going to hear that is going to be sold to you as a sexy alternative is the no shave technique, where basically they clip little hairs back here and then they go in there and they harvest one hair at a time. Well, that's very labor intensive. That takes about 2 days oftentimes to get even what I can do in about half an hour of a harvest, where there's really no downside, as I said, for the linear incision. And if you're doing that, that's a real problem, because with that, you're now having a patient lie on their face for 2 days and you're still getting a reduction in density. So remember, even if you don't want to shave your head, and that's only one of the 2 problems with FUE for women, you still have the other problem, which is you're actually reducing density on the back of the head, because you're doing it over a wide zone. You're getting a 30% reduction, 20% reduction, or a 40% reduction in the total density in the back of the head. And what is one of the complaints women have? They wear a ponytail and they clip it back there and they feel like there's a density reduction. Well, you're going to have a density reduction when you do that. So these are all the alternative FUE methods that you may think is that someone's going to tell you, well, okay, I'm not going to shave your head, but I'm going to do blank. It's either going to be a window, microstrip, or non-shave. And there's also one called the long hair one, which is basically a variation of the no shave, which is also as labor intensive. Essentially all it is instead of clipping those, they'll just harvest a long hair using a device. I own this device. I rarely use it though, because it's so labor intensive, is to go in there and harvest these hairs that are long and then place them up. The benefit of that, of course, you get immediately to see what the transplant looks like, which is awesome. But those hairs fall out in 1 or 2 weeks. So you get a nice 1 or 2 week result, it looks great, and then it's gone. Which case, in my opinion, why bother? In addition to that, when you have those hairs there and then now they're gone, to me it's more of a stark difference that you had hair, then now you're having hair come back, versus hair just slowly growing in, which is the most seamless way of doing it. So I know I've gone through a lot of detail with this video. I could actually literally probably spend for another 20 minutes talking about this topic, but these are the critical things that you need to know why I don't do FUE for women.